So when the pandemic began, I remember having a conversation with Nando and Michael, actually, about what Bernie Sanders should do. At that point in the primary election, it wasn't really set in stone that Biden was the candidate. Of course, he lost a bunch of states during Super Tuesday at that point, but it's still, there was a tiny possibility. And I thought, you know what, maybe if Bernie Sanders uses this opportunity to really highlight the failures of the healthcare system that we have, this privatized model, well, then maybe people will finally get it, because at that point, tens of millions of people had already lost their jobs and they lost the health insurance that came along with those jobs. And so the whole argument by corporate Democrats really started to fall apart. But now fast forward to where we are in the election. Joe Biden's the candidate. He's chosen Kamala Harris as his VP. And he was asked for the second time on the record what he would do about a single-payer healthcare bill that lands on his desk. Would he veto it? And here's what his answer was.
The pandemic has exposed, as I've mentioned, so many weaknesses in the healthcare system. The most vulnerable, often Black and brown communities, have been handling much of the financial burden. Before the pandemic, you were against comprehensive single-payer system. Now, if Medicare for All came across your desk as the pandemic has hit so hard, would you veto it?
It's not going to come across my desk, but look, the pandemic has not only torn through our nation, devastating families and wrecking economies, it's exacerbated some of the worst inequities. I'm going to fight for health equities, but you don't need, the quickest way to get that is for Black and Latino Americans to have access to the Obamacare with a public option. That's the quickest way we can get everybody covered.
But hasn't this pandemic and the tsunami of layoffs shown the limits of private health care that is tied to employment?
No, it hasn't, in my view. There's countries that have, in fact, single-payer systems that hadn't helped them very much either. The question is, what do we do about rallying the pandemic and treating those who are affected by it? Everyone who's affected by the pandemic is access to free care for anything having to do with that pandemic.
So that answer blows my mind, especially considering what we're dealing with right now in the United States. And I mean, think about it. He would have that legislation on his desk, which would mean it passed, with bipartisan votes. And he wouldn't commit to avoiding a veto. But I wanted to get your response to that, Leigh.
It's utterly irrational from an epidemiological perspective. The man clearly doesn't know what he's talking about. In the United States, millions of people have lost their health care, which means that going and being tested, or when drugs become, therapeutics come available, when a vaccine comes available, it means that they will be scared to go and get tested. They'll be scared to take the drugs because of the cost and the vaccine. That means that the virus will continue to propagate through society. In every single other Western country, nobody has lost their job, their healthcare as a result of losing their jobs. This is the fundamental problem with only looking at healthcare in terms of sort of inequities between the patients themselves. Even the rich are threatened by the lack of Medicare for all, because that virus continues to propagate. It's the same as if you don't provide Medicare to immigrants, even to so-called illegal immigrants, they will be scared of going to the hospital, to clinics, to see if when they get a little sore throat or whatever, and then it later turns out to be the coronavirus. They're scared to do that. That means that those people in the wealthy communities and their gated communities are still threatened by the virus. It makes sense even for rich people for there to be Medicare for all.
Yeah, it's really just absolutely infuriating.